But then what they're doing is they're sleeping wrong and they're making it worse. So then what happens when you're sleeping is your head is going to come down towards the pillow, and now you're creating a kink in your neck. And cervical radiculopathy or a pinched nerve. If this is you and this is what you're experiencing, in this video, I'm gonna go through the #1 position you need to avoid while trying to sleep, and 2 other positions that you should try in order to not only get out of pain and stop the symptoms, but get your body to heal. I'm Dr. Matthew Posa, and I'm a chiropractor in Milton, Ontario, Canada. I help people get over their health challenges so they can live the life they were designed to live. So if you like this content or more health tips and tricks, then subscribe to my page and don't forget to share with the people we know need it the most. Cervical radiculopathy, or a pinched nerve in your neck, is usually caused by a few different things. A herniated disc, you can have the roots that are actually irritated in the base of your neck, so that could have been from like a physical fall or an injury or even physical therapy. It can be as simple as degeneration and arthritic changes to your spine. Sometimes it's even medication that's irritating the nerves. Whatever the cause is, it's important to understand that when your body is that inflamed, when your body has that much pressure on it, and in fact, a lot of the people who have this type of problem are actually feeling it not only in the neck pain, but they're actually feeling it down the arm. It can go right to your hand. It can be numbness, tingling, but a lot of these people say that it's like a burning or a deeper pain that's traveling in the arm. But I can tell you this, one of the things that I notice the most with the patients that come in with a cervical radiculopathy, pinched nerve, is that their spine is completely flat. If we look at the spine model here, you know, your spine should be lined up this way, but when we look at it from the side, it should have a curve in it. This is a normal, what they call lordosis. This is a normal thing. And what this does is it doesn't put any pressure on the discs, on the joints, on the nerves that are exiting your spine, but the nutrition to your spine actually happens through compression in the back, which doesn't allow for compression in the front. So if you change the spine, we go like this, we flatten the spine. Now the pressure doesn't go through the back of the joints, it goes through the front. And this allows for degenerative changes or advanced degeneration in a lot of cases. So you're literally aging quicker. And that can cause a lot of the problems. So as a chiropractor, one of the first steps that we're going to try and do is we're going to try to correct the spine, so that way as we bring this back, we're allowing the body to be in a proper alignment, but more importantly, now nutrition, the way water goes into the joints, in particular into the disc, the way that the joints are moving are now balanced and equal, so that way we're not only stopping the degeneration and breakdown, but we're actually allowing the body to heal. But one of the things that a lot of people do by mistake is that they're gonna go to bed at night, they're gonna try and get a good night's sleep, but then what they're doing is they're sleeping wrong and they're making it worse. So let me show you exactly this position and how to avoid it. Let's start with the #1 position you should definitely not be doing, and that's sleeping on your tummy. Because the moment you sleep on your tummy, not only can it hurt your low back and everywhere else in your spine, but the moment you go like this and you lay down, you have to keep your head turned, which means that you're hurting your disc. You could be making the problem even worse, especially if there's a misalignment issue or there's degeneration or arthritis or whatever the problem is. But the case here is that you're no longer actually helping your neck. You're not even supporting it. And so all you're doing is you're furthering the damage. So please stop doing this. The only way this would be allowed is if you cut a giant hole in your mattress and you allowed for your neck and your head to go straight down in. That would be the only way that would be allowed. But you're never going to do that. So therefore, please don't do this either. Now, the best way to get a good night's sleep is really simple. What you want to do is you need to support your neck. Now, when we say support your neck, it doesn't mean that you're actually just trying to make everything comfortable and you're going to have 20 pillows or anything like that. What you want to do is, and especially when we're saying support your neck, is you got to make sure that you're helping with the curve. And so when you go, let's say, lay down on a pillow and we're laying down like this, well, what we're doing is we can support your curve that way. But let's say you sleep too far down on the pillow, or the pillow's only at your head. Well, in this position, if you look at your spine, what it's going to end up doing is it could do this to your spine. So if you have too many pillows, then what you're actually doing is you're furthering that flattening of the spine. You're no longer creating that curve, the lordosis that we talked about. So what you want to do, number one, is if you're going to sleep on your back, I would do this. Make sure that your pillow isn't too thick, and you want to make sure that your pillow is actually slightly more down your spine. Don't put it all the way up in your neck. So that way you're getting a little bit more of your upper back and you're supporting your neck. So that would be number one. But if you don't like sleeping on your back, and this happens to a lot of people too, what I would do, and if I were you, I would make sure that you're sleeping on your side. So then when you sleep on your side, the rule is a little bit different because now we're dealing with the shoulders. So if you sleep on your side, and let's say you got broad shoulders, well, the height of the pillow now would be too low because your shoulders would push you up to here. So then what happens when you're sleeping is your head is going to come down towards the pillow, and now you're creating a kink in your neck. And this is what most people do poorly, is that when they're laying down on their pillow, what they're doing is they're killing their neck. So what you want to do in this case is you want to make sure now that the pillow is slightly larger. So if you have two small pillows, something like that, I would make sure that you're getting two pillows. And not to say though that you're putting too many pillows and then your neck's going this way, right? So this is like when you sleep on the couch or something, a lot of people do this. Well, they're going the opposite way. So you need to make sure that it only accounts for the gap between your neck and your shoulder. And if you do that, then you're going to notice that your posture stays flat, and therefore you're not killing the disc, you're not hurting the nerves, you're not in the muscles, and therefore when your body can get a good night's rest and your body can actually sleep, not only does it help with the healing, but the next day when you wake up, you're going to be in far less pain. If you're having these issues at home where you're even having a hard time sleeping, now it's also affecting your back, then you can watch my other video right here that goes through specifically what you can do, how to sleep, how to get a good night's rest, and even some pillow positions that can help you a lot. So go ahead and try that when you're done watching this video. I also want to leave you with a bonus tip. Now the bonus tip is around creating a curve in your neck. So let's say you can't get to a chiropractor. I know my videos go around the world, and thank you so much for the people who are commenting and watching from all over the world. It's really a blessing to be able to talk to you, to reach you, and to help you. But one of the things that I would do if I can't get to a chiropractor, in particular a corrective care chiropractor, is I would be creating a roll. And so I'll just take a couple hand towels here. I use a couple elastics, and it's pretty simple. You would put this in the base of your neck. So again, you're not putting it in the middle of your neck. You're actually putting it kind of where your neck meets your upper back. So in through the traps. So in through your almost shoulders. And what you're gonna do is you're gonna lay down on this, and you're gonna do this for about 5 to 10 minutes. Ideally, if you can get to 15 minutes, that'd be even better, because what happens is, you know, for a lot of you, if your misalignment is like this, your head's gonna be off the ground. You won't be able to touch. And by the way, don't do this in your bed. I would do this on the ground. So if you have nice carpet, you can do it on there, on a hardwood floor, anything, but it needs to be on the ground, just not on a bed or a couch. But what you're gonna do is, you're gonna place this in the base of your shoulders, and then when you place this in the base of your shoulders, naturally gravity is gonna start pulling your head back. So this is gonna be slow and methodical, and this is the way that it won't hurt you. And then what happens is over time, what's gonna happen is your head's gonna start coming back. Now, as it continues to come back onto this, onto the pillow or onto the towel, is you're gonna actually start creating the curve that we're looking for. Your spine's actually gonna get that curve versus staying out of alignment. So if you cannot get to a chiropractor, the first thing I would do is you can start correcting this at home. You're gonna use this towel, you're gonna put it in the base of your neck, and that way you're gonna get a really good correction to your spine that's gonna even prevent this from happening in the future. If this video helped you in any way, please let me know down below. Let me know what you're trying. Let me know what position works better for you. If you have any questions, you can leave it down in the comments below. If you need help finding a corrective care chiropractor, then please let me know, and I will always do my best to make sure that you're getting the help that you need.